Hi everyone, I'm Dr. Zia, I'm a clinical psychologist specializing in transgender care. Welcome to my channel. This is another one of my questions and answer series where I answer your specific and direct questions. So if you do have a question for me that is specific to a situation, please don't hesitate to ask below, or you can email it to me directly. A lot of you have been also emailing them to me directly. So please go ahead and ask your questions. Keep in mind that if your question is diagnostic in nature, I am unable to answer it for ethical reasons, plus I don't have enough information to base my answer off. So as long as your question is general enough to be able to be generalized to a broader scenario or to be able to be generalized to a lot of other individuals, please go ahead and ask it below. If you're not sure if your question is general or broad, just email it to me. A lot of you have been already asking me some of the questions that are a little bit more specific and the required therapeutic type of setting, and I have responded to you and let you know that unfortunately I won't be able to answer your question. So just feel free to email me. I'm very accessible and I'm here to really answer a lot of your questions. Having said that, as always, I have picked 5 random questions. I have also blocked out individual names for privacy, and we're going to go ahead and answer them today. I have not read these questions. I always kind of go on a wing and just randomly pick them and don't necessarily read them prior to it. So that way, it's a little bit more fun for me this way. So let's get started. So the first question for today. Hi, ma'am. Lots of love from India. Thank you, and lots of love to you too. I don't have physical dysphoria, no social dysphoria, etc. But right from childhood, my walking style, expression, everything are like girlish. I don't have any problem with that, but if anyone says like you're behaving like a girl, then I get an uncomfortable zone. Who am I? And then you add additional to that question. I feel totally comfortable with my body, my pronouns, etc. In other words, you're indicating you have no dysphoria at all. You're very comfortable with your gender assigned at birth. You're comfortable with your body. You have no physical dysphoria. You have no problem with your pronouns. You have no problem operating and navigating life in your gender assigned at birth. The only problem is I have characters of girls. I try to change the traits, but if anyone identifies them, I feel awkward, stressed. Am I normal? Just from reading this, from what you're telling me, it sounds like you're indicating no dysphoria. You're saying you're comfortable with your body. You're comfortable with your physical characteristics. You're comfortable with your pronouns. You're comfortable. You said you have no social dysphoria. Okay. So some of your expressions and the way you like to show up in the world are more feminine. So what? Now, I know that what happens to you is that socially, perhaps especially the culture you're in, for somebody who expressing feminine qualities while not necessarily presenting as a woman may seem inappropriate. People may make fun of you. People may say that something is happening to you. People may even tease you or bully you. But the thing is, there's a lot of individuals whose gender assigned at birth is male, who have a lot of feminine expressions in the ways they dress, in the ways they walk, in their gestures, in their interests. This sounds like it has less to do with your core gender identity and more to do with gender expression and gender role. Your gender expression, your gender role doesn't fit the stereotypical box of your gender assigned at birth. So what? Don't let that stop you from being who you are. This is not necessarily an indication that you're transgender, especially when you don't have all of the other elements of dysphoric discomforts. And you mentioned you have zero dysphoria whatsoever. So I know that it's uncomfortable and you get in a very uncomfortable zone and you start to questioning yourself, but keep going back to square one. Square one is always, how do you feel about your gender assigned at birth? And it sounds like you feel very comfortable. That's going to be your square one. Your expression is just the way you like to show up in the world. And there's nothing wrong with that. So definitely encourage for you to show up authentically, own who you are. People may raise an eyebrow. People always raise an eyebrow, but it's not an indication for you to really spiral yourself into questioning your gender. I think it sounds like you know your gender, and you just really need to start being comfortable with your gender expression and your gender role. So that would be my suggestion to you. But this is a great question. And I have a lot of people asking me this when they don't really have any gender dysphoria, but their gender role or the way they like to show up in the world is not really fitting into those stereotypes. And as a result, they start questioning themselves because society is starting to push on you and starting to force you questioning yourself. So I really encourage for anybody out there not to confuse the core gender identity with your gender expression and your gender role. They don't necessarily all have to be in the same boxes or in the same flow or on the same spectrum of gender. They all can coexist together to varying or lesser degrees. So keep that in mind. But great question. Next question. Hi, Dr. Z. Your videos have been instrumental in my transition journey, and I first wanted to thank you for your great content. Thank you so much. I'm thrilled that the content is helpful. I'm struggling with voice feminization training, but not in the training itself. I'm struggling to use my voice in front of other people. Do you have any advice on that subject? Thank you for reading this message. Yes, I have a lot of advice on the subject. So first of all, I did a video on why starting voice feminization training, if voice gives you dysphoria, immediately is a must. And I'm going to link it below, but let me reiterate what I said in that video. The reason why I highly advise for people who have dysphoria about their voice or want to work on their voice to start immediately in their journey toward their authentic self is not necessarily because voice training in of itself takes a long time. It doesn't, not with a really good trained licensed therapist. But it is because it takes a long time for your brain to become habituated and adaptable to the point where when you're out there and you're using your authentic voice, you're not hyper-thinking. You're not in that hyper self-aware mode where you're overly anxious and you're thinking about how you're pronouncing words and how you pitch sounds. You're just you because now it's your innate voice. This is why I recommend for anybody who's listening to this who want to work on their voice but haven't started to start immediately. And if you can't afford voice therapists, there's definitely great YouTube individuals who create amazing content. And if you can't afford voice therapists, that's going to be your second option, and it's completely solid too. So start on that immediately. But one of the reasons why you may be struggling with expressing your voice in front of other people could be for a few reasons. Let me explain them. Reason number one, you could be struggling because this is the first time you could be actually using your voice outside of your training. The first time anybody uses their voice outside of their training is always nerve-wracking. It is always scary, there's always anxiety, and your fear could be coming from a lot of different places within yourself. Your fear could be coming because you're afraid you're going to be misgendered. Your fear could be that you're afraid they're going to be able to detect that you are attempting to feminize your voice. Your fear could be a lot of other things that you have inherently started to carry within yourself. So please recognize that if this is your first time to ever use your voice out there, it's supposed to be scary. Anytime we do anything for the first time, where we are on the observing eye of the other, we always feel scared to some extent. People who don't feel any amount of fear are people who don't have that brain chip that is able to feel those things. They're really people who fall into either incredibly narcissistic type of personalities or individuals who what we typically in psychology see as psychopaths. They just don't have that capacity to recognize those things. But for the rest of us, the first time you get on the stage, the first time you use your voice, the first time you walk out there being yourself, the first time you pronounce your name or your pronouns, you're going to feel some element of anxiety. And that's natural. So recognize that that's normal. The more you're going to do it, the more you're going to speak in your authentic voice, the more it's going to be natural for you. So start and just keep going and don't stop. It's a practice. It takes time. The second reason why you may also feel struggling to use your voice is this. And I'm not sure if I talked about it in the videos that I link below, but I talked about it in some other content for sure. When you are around people who have known you before you started transition, you're going to feel even more angst and you're going to feel even more anxiety and fear to use your voice. Family, friends, coworkers, anybody who ever known you. The reason why your anxiety is going to be even higher than with strangers is because in your head, you already know that they know what your old voice sounded like, and they already know that you're practicing your new voice. So you're going to be even that much more hyper aware and strained and stressed when you're going to be around people you know. Oftentimes, what happens to people is this pattern. They are better at practicing their voice with strangers, but when they're around their family, they get really uncomfortable because they're afraid of the judgment because they know that their family know where they were and where they're now. So they just drop it and they don't even practice it, which creates a gap and a split. And I don't recommend doing that. So those could be the reasons. But listen, it's a practice. The sooner you move past that fear, and by the way, as I always talk about fear, you're not going to move past fear. You just have to do it in spite of fear. Realize you're going to be scared, start using your voice, and start getting used to it. And the quicker you get used to hearing yourself speak too, the more it's going to be normalized within yourself, and the more you're going to feel comfortable and confident. Great question, by the way. Next question. Why do I hate myself for being trans? So often it feels like I have to choose between my faith and my family and myself. This is hard. A lot of you feel like you have to choose between your faith, your spirituality, your religion, your family, and yourself. It's almost as if you're being pulled in 3 different directions and you're starting to tear apart, and it hurts. And a lot of times it's difficult to make the decision which one matters the most. One of the reasons why a lot of you feel like you hate yourself is because to this day, the world communicates out there that you do not belong here. Now, here's the things that I really want everybody to remember about the world. Not all of the world hates you. A lot of people support you, love you, and care about you. A lot of people do. A lot of people, honestly, they neither care nor don't care. They just don't give a shit. They look at it as, this is your life. This is my life. I respect whatever you decide to do. I don't have to agree or disagree. It's your life. I can't dictate your life. But the media constantly puts out content that makes it sound and seem like the rest of the world hates you. And that's just really, really untrue. Most people are genuinely good people. Most people genuinely don't really care what other people decide to do with their lives. They're so busy and so wrapped up with their own lives. They're so busy. How is they going to pay their gas bill this month? Or how is they going to, I don't know, get ready for their marriage? Or how will they ever get pregnant? Or there's so many other questions in their life, so many other existential crises they're themselves going through. When they meet another transgender person on a street, in a supermarket, anywhere else in their life, they don't really care. They're too busy in their lives. Now, sure, they may have opinion about transgender rights, but they also don't care to impose those opinions. So you have to recognize that it may feel like all of the world hates you, but it's not true. And that's what that media that spins that narrative wants everybody to believe. It wants to scare you into this corner where you give up living your life. Here's the thing. They don't know what the fuck they're talking about. They don't know what the fuck they're talking about. They really don't. They're not people who work in this field. Nobody who works in this field and works with you will tell you you shouldn't exist because they know and they understand and they have a depth of information and knowledge when it comes to gender identity. It is a small minority of people who are hateful, small minority of people who are also not only out there on news platforms, but also on social media, who are not living their lives, who are just so spiteful, they can't wait to comment negatively. You see them on my channel all the time. I mean, I have comments that are just so, I feel sad for those people. My God, you have nothing better to do with your life? You're obviously not interested in this content, and yet you actively go and you put an energy into watching my content and then leave a negative comment. And why? It just makes me feel sad for you. So please recognize that it may feel like a lot of people hate you, but a lot of world really don't. A lot of people are actually genuinely good, benevolent people. But when you're stuck between faith, yourself, and your family, it's a tough decision. I hold an opinion that that decision, whether you should move in with yourself, should be primary. It's important to be yourself. Being yourself doesn't mean you have to transition and you have to go through the whole steps. A lot of people realize they're trans and they feel like where they're at in their life only warrants for them to just acknowledge that and accept it. Some people feel like it warrants them to come out to their families. Others feel like they need to take other steps. Steps are warranted when you feel like you need those steps. Some people don't feel like those steps are worth it. That's for you to decide. It's not necessarily a choice between you and the family. It feels like one. But unfortunately, what it is that you are in a position where you have to do something about your health. Your family is in a position where they can either acknowledge and accept that you're doing something for your health, or they can not acknowledge and not accept. And that's their responsibility, just like it is your responsibility to also do something about your suffering and your struggles. Both have responsibility to ourselves in this life. One thing that I do know is when you're not being real to yourself, my question to you is, how can you be then also real with your family? It's a tough one. There's no one answer here. It's a personal, I've worked with so many older adults who sometimes we have to sit together and we have to acknowledge that, yeah, it sounds like where you're at right now, maybe transition steps are not something that's going to feel like it's going to benefit you in the long term. Those are hard decisions, and those decisions depend on a lot of factors. We don't exist in a vacuum, and I have to respect people's decisions. So no matter what my beliefs are, even though I want everybody to be happy and everybody to be authentic, I know that that authenticity comes with a price, and not everybody is willing to pay that price. So just ask yourself how much your own happiness means to you. How much of your happiness you're losing by maintaining your status quo. This is the best answer I can give. It's a hard question, to answer because it's so personal and there's so many things going into it. Next question. I started on estradiol for 4 months and then added in micronized progesterone. Okay. I've been wondering, I'm sorry, I can't read for some reason. Haven't had enough coffee. I've had wonderful luck moving to recommended testosterone and estrogen levels within 100 days, meaning you were able to lower your testosterone and increase your estrogen levels to whatever your doctor recommended within 100 days. That's great. After hiding who I was for most or my professional life until I was 71 years old, it's a long time of hiding yourself. Why am I so scared of having such positive results? When I look younger, my breast growth has been amazing. There's a nice fat redistribution and so on. This is what I wanted, and now I'm afraid to walk through the door as a woman. Fantastic question. First of all, congratulations. A lot of people want to achieve great results on estrogen, and you're describing things that you really wanted and desired, and you were able to obtain it. So I want you to notice one thing. You're not telling me that you are still wondering if you're trans. So this fear has less to do with you questioning your identity. This is more of a fear of, hey, I'm getting all these changes and I love them, but now I'm afraid to step into my shoes. One of the reasons, the biggest reasons why you're afraid to step into your shoes is because you've been living 71 years wearing completely other pair of shoes. Guess what happens if for 70 years I've been walking in stilettos? Actually, I don't even know how long tall stilettos are because I don't wear high heels, but let's say they're 6-inch heels, right? So imagine for 70 years I've been walking in the 6-inch heels, and then suddenly I realized that my pair of shoes that is actually better fitted for my feet, and it's going to benefit my health, and it's going to make me really, really happy, are flats. Even though I know consciously that the flats, ballet slippers, for example, we call those flats, are going to make me so comfortable. They're going to ease all the pain. My suffering is going to go away. I'm going to be euphoric walking around in those flats. Knowing consciously that this is for you is different than actually experiencing and feeling it. After that long of a time wearing those high-inch heels, I guarantee you, if I started wearing flats, it would feel weird, awkward, uncomfortable. It would start making me question whether flats were really for me, whether I'm really supposed to wear flats, because your brain has been convinced that 6-inch heels are for you. So it is normal. It is okay to feel the way you're feeling. Baby steps. I always say baby steps. Baby steps, little by little. Maybe stepping through the door as a woman. I don't even know what that means for you. Like, as a woman, what do you mean? Like, as fully expressing yourself as a woman? If that's the case, maybe that's just a little bit too much for you right now. Maybe scale it back. Maybe walk through the door more feminine. The next day, do it again. Do it for a week. Do it for a month. Then really increase it. Then really walk out through the doors the way you want the world to see. Sometimes we just need to give ourselves time to walk in the shoes, to realize that those are the shoes we should have been walking all along. And we have to give it time to make the pain go away. We have to give it time to get comfortable. So give yourself some time. 70 years of living your life, it has been a very long time. So definitely give yourself some time. So that would be my advice to you. Get used to wearing flats, because flats are really shoes for you. Or you can switch my analogy. Maybe I've been wearing sneakers all my life, and high heels in here now. The shoes are for me. Whatever fits you the most. Next question, and this is, I believe, our final question for today. Hi, Dr. Z. First of all, thank you so much for your YouTube channel. You are most welcome. Maybe I'm going to start to block out all of your wonderful, wonderful gratitude, because when I read it, it's starting to sound like I'm blowing my own horn, and I really enjoy doing what I do, and knowing that I help all of you, or even a small percentage of individuals struggling with gender dysphoria, means a world to you. If I can shed light on why you feel the way you do, and help you feel better, or help you make those baby steps, or motivate you in any way, or break down any doubts and fears, then I'm consider that I really done what I meant to do on this planet Earth. There are literally no words to express how much you and your channel have helped me on my journey and transition. My question is this. I've been on estradiol for about 3 months. I've started growing breasts, which is great, but I have an issue. My breasts are growing kind of crazy fast, and obviously I'm super excited about that. How about 3 weeks after starting the hormones, my nipples became super sensitive. Like, even the slightest touch hurts. I've been wearing those gel things for going braless as protection. Sorry, the font on my printout is so small and I need bifocals. At first, I thought I was just going through a fox period, but it has now been like 6 weeks and they still are super sensitive. Is that just because my breasts are growing so fast, or is it something else? I know they say that if you look at most women in your family, that is actually kind of true. That should give you an idea of what you expect for breast growth. Pretty much all the women in my family are very large-breasted. I'm kind of wondering if that's what's going on. I don't know. So, congratulations, first of all, because it sounds like you're really excited with the results you're seeing, and it's like you said, you're really excited about it. But you're starting now wonder, holy shit, it's only been 3 weeks. They're growing super fast. They're super sensitive. Is there something going on? Also talk to your endocrinologist or provider who prescribed hormones to go over what might be going on. In my experience with clients with whom this exact phenomenon happened, nothing was going on. In my experience, what was happening is that for some individuals, your breast area, especially what's really very sensitive is not so much your breast, but it's your nipple and areola area. For a lot of individuals, that area just innately, naturally is more sensitive. There's more nerve endings than for a lot of other individuals. And so when your breasts are starting to bud out, that area is starting to bud out and grow, it can be so sensitive to the point where I had clients I worked with where they couldn't take a shower because even shower water falling onto their breast was really sensitive and was hurting them. Or anything brushing against their chest, even if they were carrying books, for example, and they brushed against their breast, would hurt. That's hurting feeling is very intense sensation, sensitivities that your nipples are experiencing, and it feels like pain. Part of it is because you're not accustomed to it. Part of it is also because this area of you is growing, it's maturing. In my experience with clients, eventually it starts getting less and less uncomfortable, but the nipple area remains to be a very sensitive area, pretty much all the way over the years. And that's not even itself a bad thing because nipples are very sensate, they're very pleasurable, especially during sexual and intimate activities. So in of itself, that's not a bad thing. Our body has all these sensitive points and it's meant to have sensitive points. So I wouldn't really worry about it. I would just, like what you're doing already, you're putting those braless gel things, they should help. Ask your doctor, maybe there's something else you can do to minimize the sensation to really help you throughout the day if it really bothers you a lot. But chances are with some time it will go away. But your nipples will most likely always be very more sensitive than other people because you probably just have a lot of nerve endings in that area than most people, and that's not a bad thing, but very, very common when breasts are starting to grow. A lot of times also I see this, individuals confuse that they are going to get naturally really large breasts when they start on hormones and their nipple area starts to grow first and it kind of butts out like a little bud, like a flower bud. And so people feel like, oh my God, I'm experiencing a lot of growth, and they freak out and they stop hormones, especially if you're not out yet. You start to freak out. What if somebody's going to notice? A lot of times that spur of nipple growth is just that. It's a spur of nipple growth. It is oftentimes challenging to really get a really large breast growth on hormones alone. People who were obtained to kind of a handful of good breast size who are very lucky. It has to do with genetics, has to do with how your body also metabolizes hormone. But usually it's not like you're going to start hormones and overnight you're going to wake up with large breasts. But very common to have that extra sensitivity to the point where it's painful to touch them. For you, still consult with your doctor, ask them if there's something else going on, but I'm pretty sure this is just natural part of your breast growth. And try to do things to minimize that sensitivity. Maybe pay attention to what you do and be careful when it comes to breast to avoid that extra sensitivity that you're experiencing right now. So great questions for today. As always, please comment below, leave your questions. I'm go through my channel, as you know, all the time, comment to a lot of you. And when I see questions, I just go ahead and screenshot them and then get ready to input them into Q&A series. So ask your questions, email your questions, and comment below if any of you have tips or advice or suggestions or anything you would like to share in terms of this particular questions. Comment below, let me know. Love hearing all of your comments, and I will see you all next time. Bye.